Hello, I'm Nick Mills, speaking with Dr. Michael Wyand, the CEO of Oxeia Biopharmaceuticals. Clinical trials are underway now for Oxeia's promising therapeutic drug, OXE-103, aimed at treating concussions, also known as mild traumatic brain injury. Michael, what is the extent of the problem in the U.S.? How many concussions are reported every year, and perhaps how many go unreported?
I think that's a very good question. Approximately 3 million people in the United States go to the emergency room because of a head trauma. Of that number, luckily, about 80% turn out to have mild traumatic brain injury, or what we would call concussion. But that number is much, much smaller than what the true number of concussions are. Most athletes do not go to seek medical help or go to the emergency room. They're diagnosed and treated on the sidelines. And because most people understand that there's no therapy for it or treatment for it, many do not try to seek medical help. So it's estimated that only 1 in 6 concussions are diagnosed.
We hear about concussion mostly in the context of sports, especially the violent contact sports like football and hockey. But do they account for the majority of concussions aside from sports? How do most concussions occur?
So sports are definitely a major cause of concussions, and they're certainly one of the reasons why there's so much discussion about concussions today. So thankfully, the athlete has brought that to the forefront. The number one cause of concussions for people that do seek medical help are falls. They happen in younger people that fall off bicycles or skateboards or a variety of other things that they might be climbing on. It happens in adults falling down the stairs, losing their balance, those types of injuries. It's very difficult to know what the exact breakdown would be of what I'll call the civilian population and the sporting population, but I suspect that there's more concussions occurring outside of sports than there are in sports.
And what about the annual doctor's bill? Is there any estimate of how much the annual healthcare cost is associated with concussion?
There are estimates, and people have studied that and looked into it. Some of the estimates that we've seen go as high as $800, $900 million a year to treat concussions and to treat the fallout of this injury. Most of the medical care is given days to weeks to months after the injury for people who are experiencing prolonged significant symptoms. Those folks tend to seek help from a neurologist or a sports medicine person, and there are concussion clinics around the country that are trying to treat those people. Unfortunately, they don't have any good therapeutic regimens to be able to use as a treatment, and mostly focus on things like physical therapy.
Well, all right. We'll talk about that in a future segment. In our next segment, we'll talk with Dr. Wyand about post-concussion symptoms and treatment. I'm Nick Mills.